Greetings and salutations to our listeners and subscribers, and welcome to episode 4 of the Pharmacist Matters podcast. I'm your host, Justin Bates. I've almost lost track of what week of the pandemic we are in. It has been an interesting era to observe how society continues to adapt to the restrictions of movement and practicing social distancing. In Ontario, we have entered into phase 1 of the economy reopening, and already phase 2 is delayed as new COVID-19 cases emerge. I'm sure we all saw the news of people gathering at beaches and public parks with the warmer weather upon us. As more time goes by, it becomes increasingly difficult to ensure that the public adheres to the safety measures. I know I'm going to find it very interesting to see how many of the consumer behavior changes will stick around and what types of healthcare transformative forces will impact how healthcare is delivered. One of the thoughts I have, for example, is how will virtual health continue to be offered as a service? Is it here to stay? We know that the technology has been around for some time, but the adoption of it has been hit and miss. One of the hopes I have for this new era that we're entering into, or the new normal, as many people say, is to ensure that we continue to offer these types of services to patients, be it in pharmacies or through technology and virtual care. Other questions I have is, will working from home be more accepted and a permanent part of corporate cultures moving forward? What's the impact to real estate in downtown Toronto and other major cities? Will we need as much square footage? And how will we measure the productivity and outputs of employees? If we think about it from a pharmacy perspective, if we don't evolve our practice models and seize this opportunity to showcase our value and realize less reliance on the dispensing activities as the primary source of revenue for pharmacies, I believe firmly that the role of pharmacists will become obsolete. We know that artificial intelligence and automation is going to take on a greater role in terms of the core dispensing activities. And if we don't embrace this change of getting more expanded scope of practice with the corresponding reimbursement to truly help patients manage better their health, then we will miss out on this opportunity to pivot. It's not all bleak, because there are great opportunities to shift our advocacy efforts with respect to how can we play a greater role to help patients manage during the pandemic and beyond. At OPA, we have shifted our advocacy efforts onto a 3-point plan to help the government reopen the economy and support public health efforts. This includes investigating the role of pharmacies in providing testing for COVID-19, which assumes the appropriate level of personal protective equipment. And certainly testing can go beyond COVID-19 into other areas of diagnostic and rapid testing for strep, as an example, or rapid HIV testing. But for now, let's focus on what can we do similar to the US, and what kinds of models do we need in order to provide a solution to increase capacity for testing of COVID-19. The second point in our plan is to ensure that the high-dose flu vaccine is included in pharmacies. This has been ask of OPA for several years. And given the spike in demand that we're seeing in Australia, upwards of 25%, because patients, the general population, is looking at this and saying, I better get vaccinated. So with this upcoming flu season, it's going to be more important than ever to ensure that pharmacists are the gatekeepers to discerning who should get the high-dose flu and who should get the regular dose. We also need to ensure the distribution of the future COVID-19 vaccine is in pharmacies. We are the most highly accessible healthcare provider and a convenient destination for patients. And as we have witnessed in the past with the flu shot program, patients overwhelmingly prefer to enter a pharmacy for a flu shot. In addition to all of that, we can play a critical role in tracking the data for public health purposes on who has been vaccinated within the population. Now, in addition to our 3-point plan, we continue to advocate for the implementation of a government-funded common ailments program and enabling therapeutic substitution to help manage drug shortages. As we have seen with some of the recent surveys, drug shortages continues to be a challenge, and we need to make sure that Ontario pharmacists have all the tools in order to appropriately and safely manage patients. I'm also excited to announce that we will be launching an advertising campaign in the coming weeks and months to celebrate the profession and underscore the value of pharmacists to both government and the general public. Pharmacists have done unbelievable work during this time, putting themselves and their families at risk in order to ensure that patients continue to receive their medications safely, whether it's the measures they put in their stores, increasing home deliveries, and being there for their patients. We need to celebrate what they have accomplished during this time and use this as a springboard to continue to build the positive perception within the public of what pharmacists can do and how they play an integral role within the healthcare system. Throughout the pandemic, OPA's advocacy has been focused on helping pharmacy professionals by providing valuable resources and tools. You will have noticed through our social media platforms, as well as through our member communications, that we've developed a number of guides that provide resources for pharmacists, whether it's from sanitization of their stores to PPE, to how to generally manage patients through this pandemic. Today, I would like to talk about two specific areas that have been a focus for OPA since the pandemic began. The first area is PPE, or personal protective equipment, which we know has been a constant issue for pharmacy professionals and other healthcare providers. And early into the pandemic, OPA partnered with a company called RONCO to try to get PPE into the hands of as many pharmacists as we possibly could. Joining me on the program today is Johnny Paspalovski, and later in the program, joining me will be Jason Kreller from Relief Buddy to discuss our partnership with OPA members. Earlier in the pandemic, both organizations jumped into action to bring a needed solution to pharmacy professionals. Let's start with Johnny. Johnny is the Director of Business Development for RONCO. RONCO is a North American manufacturer of personal protective equipment. Johnny has been with RONCO for more than 9 years. Johnny, tell us about RONCO and why RONCO stepped forward to provide this needed service to pharmacists in Ontario.
Most definitely. Thanks for having us, Justin. A little bit about RONCO. So RONCO is a world-class manufacturer of PPE. We've been in business since 1996. The reason why we stepped forward to provide the needed service in the pharmacy was our understanding that the pharmacy segment was not being provided with the necessary PPE during the pandemic. I had the opportunity to connect with the senior leadership team at OPA, which supported the statement. Once we had identified the need, we set forth an objective at RONCO to provide pharmacies with PPE in order for them to perform their applications in a safe manner.
Thanks, Johnny. Maybe you could elaborate a bit on the challenges that RONCO has faced in acquiring PPE, as I know there's certainly domestic and global supply chain challenges. And as we hear about, many different healthcare providers continue to have challenges accessing quality products and having the appropriate PPE for serving patients. So maybe just a few observations from your perspective on what you've seen throughout the pandemic.
Yeah, most definitely. So we have seen and continue to see challenges externally, but there was also internal challenges we faced along the way. So as a global manufacturer with an established customer base, we had to select key products that wouldn't affect our obligation to others. Having said that, we had to squeeze in already tight production schedules, these key items. In manufacturing, lead times are about 3 months pre-pandemic with forecasted orders. We did not have the time nor information, but we were ready to take on the challenge. So I convinced our senior leadership team at RONCO the need to step up and create a new division at RONCO in order to support this new business unit, which we established internally as retail. The norm for starting a new business unit usually takes 4 to 6 weeks pre-pandemic in our business. We had done so within 1 week during the pandemic, which is a great success story on its own. Our team put and continues to work around long shifts around the clock to drive this business unit forward. Externally, it's literally out of a movie, best described as the Wild West. Raw material prices are going up 10 times on items such as non-woven products being your masks, for example. You have workers in many facilities making much more than they did pre-pandemic. Not having facilities shut down in certain regions And not until recently, we are starting to see 100% of capacity back with regards to staff at some facilities, while many other facilities are still operating at 50% or less. Demand has surpassed supply by 9 times on some items like disposable gloves. There's lots of new players that are importing products and PPE products without the expertise in manufacturing, product, and most importantly, lack of quality control, as we've seen on the news. Some factors of why prices are skyrocketing is the willingness of new companies to pay 10 to 20 times more of the market price, which is setting the new market price for raw materials and finished goods. If you think of the house market in Ontario in recent years, people bidding on homes and willing to pay whatever it takes to acquire the home. This is what's going on in the world of PPE today.
I find it fascinating. It really is a Wild West the way you described it. I know everybody knows or thinks they know a guy who knows a guy who can get supply. And you've seen some of the devastating impacts of lack of quality control with some of the purchases that Ontario government has made, other healthcare providers, City of Toronto, where they had defective material. So, I think having a solidified and trusted brand like RONCO is really important. And we're quite fortunate at OPA to have forged forward with this partnership with RONCO at a time when really what we wanted to do was make sure that the appropriate PPE got into the hands of Ontario pharmacists. I know we have we envision certainly expanding this into other provinces and areas, but our first priority was to get protection for the frontline, and in particular pharmacists. A lot of work has been done on some best practices for the use of PPE, when and how to use it. Education by the Canadian Pharmacists Association, among other provincial and federal national associations. But it's been really helpful to be able to demonstrate the value that we've been able to offer our members and non-members. And just wanted you to talk a little bit about what you've seen, some of your perspectives on the quality issues and what you're seeing and reading in the news since you've been in this business for so long and supplied many different industries.
So what I've seen, so there's been lots of new players in the market. And when I say lots of new players, a lot of them for the greater good. And the challenge that they're having is it's not a presence in the countries that they're manufactured. So if you look at, for example, the majority of raw materials of non-woven. So when I say non-woven, that's the main raw material for masks, for example, and other products like bouffant caps and balaclavas. But in general, you're seeing they don't have a presence in China. Like you said, Justin, someone knows someone who knows someone who has the money to purchase the products and sell it here domestically in Canada. Whereas RONCO, we actually have an office of where we have some of our staff for quality management, as well as we sell domestically in China and have for many years with distribution centers across China, and as well as a very intense quality unit in China where everything is manufactured is to our specifications, of course, and where we have everything's going to be. There's room for in manufacturing. There's room for when it comes to quality for error, so to speak. But as RONCO's quality with respect to masks and disposable gloves, our room for error is less than 1%, something we're very proud of.
That's great to know. I wonder what your thoughts are about this from a market perspective, normalizing in terms of demand. I think one of the concerns that certainly we have at OPA is as the public starts to hear and receive advice from medical officers across the country, including in Ottawa, that the public should be wearing face coverings. We're concerned about having supply of medical grade PPE diverted into the public, but at the same time, present some opportunities. On top of that, we know there's an upcoming flu season. It seems odd to be talking about flu season in almost the end of spring, but the reality is that all the planning that's going to go into the flu season coming up in October happens now, from ordering of dosages to making sure that pharmacists, doctors, nurses all have the appropriate level of and quantity of PPE. So knowing that there could be a second wave of COVID-19, And even knowing that a couple of weeks ago, the World Health Organization essentially changed it from a pandemic and labeled this COVID-19 as an endemic, meaning it's in its a sense permanency, and will be not episodic. So we know that this isn't going to end anytime soon from a business, but also more globally. What do you see demand normalizing and supply replenishing, or is this our new normal?
Very good question. It's very hard to answer that. There's so many external environment variables. The demand for disposable gloves, for example, has skyrocketed from 700 times demand versus world capability of supply to now 900 times. And that just came recently within the past few weeks with Russia and Brazil trying to acquire disposable gloves and more PPE. I see there's going to continue to be a struggle with respect to raw materials. There's masks are easier, more say or less to manufacture, but when it comes to items like disposable gloves, disposable glove facility is quite large, and obviously there's a lot more than just importing a disposable glove with the lack of facility. So in a nutshell, it's very hard to answer that question. I personally don't see the light at the end of the tunnel yet, but I hope to see it in sometime in 2021. But I think 2020 is going to be a rough year with respect to PPE in our industry.
Yeah, undoubtedly. So in some ways, this is a new business opportunity to be involved in the pharmacy market. Maybe you can just comment on pre-COVID-19. What was RONCO's primary target markets? And I know you've done some excellent work to re-engineer some of your internal processes to be able to accommodate doing some of the individual orders and drop shipping, logistics, and order fulfillment, and we've certainly now come up with what I would call a very well-oiled process for pharmacies in Ontario. But prior to all of this, what was RONCO's target market?
So RONCO, we're a manufacturer, so we're not a reseller. So our target markets were pretty much food processing. So in Canada, RONCO is a very, very strong player in food processing, in pharmaceutical manufacturing, as well as industrial manufacturing, but our strongest market vertical globally would be food manufacturing. We have a little bit of a focus to our resellers with respect to the medical industry, where they sell to hospitals and other medical applications. But in terms of our current customer base prior to partnering with OPA and the pharmacies, our largest one would be food processing, followed by pharmaceutical manufacturing.
Knowing some of the challenges around quality, how can the average person be assured of the quality of the product and the medical licensing side? What advice would you have for people, whether it's the general public or healthcare professionals that are looking at these types of products?
I'll start off by saying this: Photoshop is an incredible tool. We've seen a lot of, we've even seen our certificates circulate in the US, and I'm not too sure if I've seen it in Canada with a lot of Photoshop over our documents. But what you can be assured is with working with RONCO is a quality-focused organization. Our mission statement states as we're able to provide our customers with consistent quality products to enhance user safety, confidence, and productivity at competitive prices. Our main objective being is to provide consistent quality products. You will find a lack in quality in the market today from others during the pandemic, as most players are reactive to present-day opportunities. RONCO has 2 quality control teams, both in Canada and in China, as I was mentioning earlier, and all RONCO employees are dedicated RONCO employees. We don't use any agents in order to adhere to our strict policy. RONCO has ISO 9001 for quality management systems. We're also ISO 13485 for the medical, and we also have a medical device license. Our quality manual and policies are online for everyone to view. We are known globally as a quality leader in the market. Our business principles are based on 3 Qs for quality, with respect to quality in processes, quality in service, and quality product. RONCO also has a clean and safe guarantee from the raw materials we source to the manufacturing facilities to control the product. When it comes to quality in a nutshell, you can see where RONCO really strives with quality. It's at the end of the day, it's someone can know someone who import a product or to get a medical device license under the pressures of the government to get key supplies. RONCO has been driving quality, and all our certifications have been from the 1990s, and we continue to adapt and keep up to date with all the ISO regulations, being a global company.
I like the three Qs. I think that really resonates with people. And it is important for people to understand what's authentic and what's not, particularly as it relates to the greater need for protection and safety to keep our frontline safe. I think one of the things that really grates on me is healthcare professionals that either don't have access to the appropriate PPE and are putting themselves and their families at risk, or have access to defective PPE. So I think this is a critical conversation for people to understand that they need to do their due diligence. And on that front, I don't know if you're aware of this, Johnny, but the government through the Ministry of Health has a website where they list a number of PPE suppliers. And it really PPE across the board, from hand sanitizer, face shields, gowns, gloves, masks, etc. Do you want to discuss, is RONCO going to apply to be on that list, or did you make any decisions on that front?
So a little bit about the list. So RONCO is on the list. Last night we put ourselves on the list. And I wish it was harder to get on the list, but it's not that difficult to go on the list. We were asked to be on the list. We denied it. We didn't want to be on the list. But as of last night, we were on the list. The reason why we felt in the beginning to be on the list is we're a manufacturer. I would say roughly, by first glance, 90% of the people on the list are resellers. What I mean by resellers is, for example, now pharmacies can be on that list because they have product. So even many of RONCO's customers, mature customer base, is also on that list already. So there's very few to no manufacturers on that list. But RONCO is now on that list as of last night. So we just felt, as a manufacturer, there was no need to be on that list. But many people, I think it's the knowledge of that list, what it really means. A lot of people thought that those were a lot of manufacturers on that list, but at the end of the day, there are resellers. So people who import products, who buy products locally here and are reselling it are on that list, but not all of them. And now RONCO is on that list.
Well, that's actually great to know, and appreciate that up-to-date information. So I just wanted to say again how appreciative OPA is of RONCO stepping up and providing this needed service for pharmacists. I know in terms of our advocacy to government on behalf of our members, a lot of what we're talking about is we shift our focus into scope of practice and providing certainly more capacity in the healthcare system, whether it's related to testing or clinical services. And I do think we're going to see a hybrid model move forward of more virtual care and hands-on clinical services in stores. But I do think the need of PPE is going to drive a lot of that decision making, because without the appropriate access to PPE, there will not be much appetite within the profession to provide these services. So it goes hand in hand, so to speak. Access to the PPE, continual and sustainable access will drive a lot of the ability to not only reopen the economy safely and ensure that we continue to not see new cases emerge of COVID-19, but also to continue to have all healthcare providers step up and provide the much needed services. We all know that physician offices, some of them have closed, and that has put an influx of patients into stores, pharmacies, and other healthcare providers. So, this to me is one of the linchpins of successfully opening the economy and keeping patients and consumers and healthcare providers safe. So, thanks again, Johnny, for all that you're doing, and we're very appreciative of the partnership.
Thank you for having me, and thank you, Justin. I appreciate the partnership with OPA as well. Thank you.
Great. So at this point in our program, I wanted to shift focus to have a conversation with Jason Kreller of Relief Buddy. Jason is the president and co-founder of Relief Buddy. With roots in family business, Jason has a background in working with small business owners, specializing in private capital markets and estate planning. Jason started with Relief Buddy to help create a better staffing solution for the pharmacy industry. Jason, I've heard a lot about Relief Buddy over the last several months as OPA and Relief Buddy have been in various discussions. But I think it would be helpful for our listeners to have a better understanding of what it is that you offer as a service, and a little bit about the company. I know you were one of the first to waive fees so that pharmacies could remain staffed during the pandemic, which I think is a great indication of your commitment and passion for helping during these unprecedented, challenging times. But why don't you elaborate a little bit about the company and our partnership?
Okay, thank you, Justin. I just wanted to take the time to thank you for having me a guest on the podcast today. It's been a pleasure working with the OPA so far and furthering our partnership. Relief Buddy, we are an automated relief staffing platform for pharmacies. So what we've done is we've modernized some of the traditional ways that pharmacies had to procure relief staff for their pharmacies. And by doing that, we've been able to create an efficient platform that also saves pharmacy managers and owners time. It allows them to have more control over who they're hiring for their relief staffing needs. And due to the fact that we are an automated platform that is available on the iOS and Android platforms, we're able to cut out a lot of the overhead costs, which means that we can pass those savings on to the industry. So we charge generally less than half the fees of a traditional agency type of staffing solution, which means that those savings get passed on. So we can offer higher wages and attract great quality so the pharmacies can have great staff coming in to fill their gaps when they need them. One thing that we really value as a company that is, starting out and growing and very passionate about the industry is that we're highly committed to being part of the pharmacy community and working with industry stakeholders such as the OPA to help contribute in many ways. Now, when the COVID-19 pandemic came about, there was definitely a number of challenges specifically in the pharmacy industry. And the first thing that we thought of as a company was, what can we do to help and contribute and do something for these folks that are on the front lines? There's a lot of uncertainty. There was a lot of nervousness. And the one thing that we thought we could do was waive our administration fees. So what that meant was we could put a bit more money into the pockets of the pharmacy professionals that were really, putting themselves on the front lines, taking the risks, having to deal with the fears. These people are family members, they're, having to go into work. And, one thing we thought we could do as a business and show our support and show that we had their back was waive our administration fee. And to my knowledge, we were actually the first company to do so. And we were it was very well received, and we were more than happy to do it. So for the months of April and May, we had waived our fees just so we could do a little bit for the community, put a little bit more money back in their pockets. And the OPA relationship has been extremely beneficial for us because we have a resource where we can reach out and determine, different ideas. We can get really good perspective on things that are up and coming and really get a good ear to the ground in the industry, because we do have that commitment to working with the stakeholders and really helping be a great member of the pharmacy community.
One thing that I know for certain is that consumers, whether it's B2B or B2C, have long memories, and how companies behave during times of crisis, particularly now that we're in this unprecedented time with pandemic planning and really uncharted territory. We all are learning from what we are experiencing in real time. and companies like yourself that go the extra mile, so to speak, and really think about it from good corporate citizenship and how can you help. We'll have, I'm sure, long-term brand equity from doing things the right way. So we definitely appreciate that, and I think that's a strong signal for your company's commitment and dedication to the profession. How long has Relief Buddy been around? And sort of follow up to that would be just a little bit of background of the company and understanding what are you seeing and on the ground in terms of resources, the needs, the gaps given COVID-19. I mean, we hear a lot about people having to self-quarantine and staffing challenges because, of course, anyone that comes up with a symptom in a pharmacy needs to self-quarantine for 14 days. So, but I wondered from your perspective, what are you seeing? Because you have, I'm sure, a lot of that data through the app.
Right. Yes. So to answer your first question, Relief Buddy had started in late 2018. The concept was started by a pharmacist. I was introduced to them. They had just, got a platform off the ground, had a great concept, knew that I had a number of relationships with folks in the industry. And in January 2019, myself and a couple of other partners, we took over Relief Buddy and we designed the new platform as you see it today. We started out last year doing things the manual way. So we acted very much like a traditional agency. However, we did have the lower fees attached to our services. But in December 2019, we finally went out live with our enhanced platform and have been functioning on that new platform since. So one of the things that we saw, because as you said, there was a lot of different, there was so much news happening at the start of COVID-19, and everyone was really scrambling to figure out best practices, what not to do, how to manage their pharmacy, how to, what do they do from a PPE perspective, but also a resource management perspective, because like you said, there was people having to self-quarantine. Do they restrict access to their pharmacy? So they limit the number of customers coming in. Just that on top of the fact that they're so busy on a day-to-day basis already with the common pressures just of operating the business. It was very difficult and so many uncertainties, and everyone was just kind of, trying to figure things out as they went. There was news coming out constantly, sometimes, different contradicting news. But the one thing that we did, and, it's a testament to the great partnership and relationship we have with the OPA, is being able to reach out and make sure that we were doing all of the things that we needed to do as a company to protect both the pharmacies and the pharmacy professionals coming into those pharmacies if they needed a resourcing, to fill a resourcing gap. So what we did was we engaged with the OPA, made sure everything was, the most up-to-date types of procedures. And the specific thing that we did to make sure that, to ensure the safety of both our pharmacy users on our platform and the pharmacy professionals was that we made sure that every time a shift was created and booked on our platform, the pharmacy, when they posted it, they had to put in detail what their COVID-19 precautionary measures were. So every shift that was on the platform, in the comments section, the pharmacy professional would see that COVID-19 protocol for that pharmacy. So if it included having PPE equipment available, plexiglass, in different areas of the store, specifically the front counter, if it included limited access to the pharmacy, all of those different types of things, because we wanted the pharmacy professionals that were looking at the shifts to consider whether they wanted to take them or not, whether they would be comfortable based on the COVID-19 protocol that that pharmacy had been following. So that was very important. And then on the other side, we also wanted to make sure that the folks that were going into the pharmacies weren't going to be creating a risk to the pharmacy, right? And make sure that, they hadn't been traveling, different, types of things like that, to make sure that both sides were protected. So those are some of the things that we did to make sure that people were safe.
Sounds like you've made a lot of changes to the app in order to adapt to the current circumstances, which is great to hear. One of the things that I learned that you engaged on was to help pharmacy graduates who can't take their exams. Maybe you can elaborate a bit on what that initiative is all about.
Yes. Once again, just like any business, the need to be agile is paramount, especially, when you're a technology-based company. So what we did is, we really like to have a good pulse on the industry and what was going on, and we followed things very closely. One thing that we found was there was a greater demand coming through for assistants and technicians. Now, that increase in demand is very difficult to manage because there's actually a limited supply in those resources from a temporary staffing perspective. So the one solution we looked to was, there was a unique opportunity right now because, those fourth year grads hadn't had the opportunity to finish off their, final exams to be fully licensed. So since there was this, need for technicians and assistants and other staff, we talked to the OPA and engaged with our partners at the OPA to talk a little bit more about the dynamics and how this could actually, work, and how we could integrate this into the app. We actually worked with some of the folks at the U of T and engaged with them as well to talk to them about how they could potentially reach out to their membership, their students, to get the word out about the changes that we were making. And we worked with our development team in order to create a new role. So what we did was we created a new role for students and interns. So those fourth year grads were actually considered on the Ontario College as interns. So yes, they could do a lot of the things that a typical pharmacist could do. They did need a little bit of supervision, but what that did was that allowed us to create a resource and adapt so that we could take on the increase in demand in different roles, and also provide opportunities for those folks that unfortunately had got caught in the middle with all of these things going on. So it was good because we were able to engage once again with the industry stakeholders to provide and adapt and get a solution out there that met the needs of the changing times.
It's really fascinating to me how you have evolved the app and really filled some gaps for pharmacists and pharmacy professionals. Maybe to conclude, it would be great to hear from you on the model and what it means to keep it in the family. You talked a little bit about waiving fees and some of the referral programs, but just to emphasize this as a keep it in the family business.
Right. Well, I'm glad that you asked that, Justin. So that is one of our philosophies at Relief Buddy is, like I said, we're passionate about the pharmacy industry. We like to, and yes, I do use that key term, keep it in the family, and I mean that when we talk about it. So what that means is, we like to give, so we're a resourcing company first and foremost, human resources. And what we like to do is offer as many opportunities for those in the pharmacy community as possible. So one of the things that we've been doing is offering employment opportunities for pharmacy students. So we've had a number of pharmacy students working with us. We really want to give them the opportunity to earn some money and be able to work in a capacity that helps them develop other skills outside of working directly in a pharmacy practice, but learning some of the other types of skills that could really complement them and create, leadership skills and things like that. So when they go on in their careers, they have other skills that they've developed and been able to adapt and apply when they get out into the industry. So we're really passionate about helping those folks out. We have referral programs where we like to, give back to the folks that, refer us to other people, whether it be for permanent positions, things like that. So we really like to, find different ways for, the pharmacy community, especially the pharmacy professionals on the platform to earn different sources of income, right? So we're really passionate about that. We're going to continue to, try and employ as many people as we can that are directly related to the pharmacy community and keep it in the family.
Thank you, Jason, for sharing your insights and additional information about Relief Buddy. I feel connected to you in ways that, I think is worth describing because comically, I get Jason as a name probably about 50% of the time from folks, even though my name is Justin. Jason is one of the things that people seem to call me. But I feel like at this point in my life, there's no sense in correcting people. So I just go with it. So I can be Jason or Justin. Anyways, thanks again for joining us. I think that was really helpful for our listeners to gain additional insights into the partnership with Relief Buddy. On our next podcast in mid-June, we will be celebrating Pride Month with a series of special guests. I want to thank everyone today for listening to the Pharmacist Matters podcast. And until next time, be well and stay safe.